So we continue our discussion with Haihong Cai, adult nurse practitioner at the MD Anderson Cancer Center, specifically in the area of proton therapy, there at the Proton Therapy Center. And you have submitted a presentation regarding the management of acute toxicities during radiation treatment of non-small cell lung cancer. Talk to us about that.
Radiation is one of the standard treatment for the non-small cell lung cancer, either as a curative intention or a palliative treatment. So, however, there's a lot of toxicities related to the radiation, especially when we in a setting of concurrent chemoradiation in a curative intention situation. So, which a lot of toxicities will show up, especially after 2 to 3 weeks once the treatment starts.
What kind of toxicities are we talking about?
A lot of time is you will see a lot of skin reactions from the radiation, and also most importantly, which impact the patient quality of life, is esophagitis, and as late toxicities is a cardiac impact, cardiac toxicities from the radiation.
Coming back to the skin issues, it may be compounded then for the patients that are getting oral therapies that also cause skin rashes and reactions on top of the skin reactions they're having to radiation. How do you manage those?
So the skin reaction from the radiation is a little bit different from the skin reactions from the chemotherapy like Taxivas or the EGFR treatment. So the radiation skin reactions is localized in where the radiation field.
So we're just clarifying and differentiating here that there are reactions that may happen to the skin based on the oral therapies and the chemotherapies, and then there are deeper reactions that are consequences of the radiation that are going on internally, which are normal.
That's correct. This happened to almost every patient whose esophagus in the high dose of radiation treatment field. However, if a patient is treated with a peripheral lung lesions and not in the mediastinum areas, the treatment will not affect their eating.
Is it necessary for all patients to receive both radiation therapy and chemotherapy or one of the new targeted therapies?
This really depends on the patient situation. For a patient who have localized disease, early stage like stage 1, stage 2, radiation alone may be enough. So, and also could be very short period of treatment, maybe a week of treatment will be good enough. And however, for a patient who have locally advanced non-small cell lung cancer, concurrent chemo and the radiation, maybe even surgery.
And you mentioned IMRT, and it's of interest to note that, in the old days of radiation therapy where there was a beam that went in, today the way you treat is, the beam may go around for more equal distribution, sparing the upper layers and really getting to where you need to treat. But again, you're still dealing with a very vulnerable area. And so, as you mentioned, the esophagus and other areas within are irritated. How do you treat that?
Using IMRT, it's a multi-leaf technologies. So the machine will conform to the tumor site, to the shape of the tumor from different angles. And usually using IMRT, we treat the patient from 8, 9 different angles to the tumor in the lung, so that from each angle, the beam shape in the tumor from that angle, then different angle has...
Yes, it conforms to the person's tumor.
That's correct. And also, so that the surrounding normal tissue will receive less radiation. And plus, at MD Anderson, we also use a 4D CT simulation, which means we tracking the tumor when during the breathing cycles, breathe in and the breathing out cycle, the tumor moves. So using the 4D CT, tracking the tumor to decrease the toxicity as well, and cover the tumor much better.